My name is R. David Anderson. I'm a professor of medicine at the University of Florida in Gainesville. I have about 20 years of experience as an interventional cardiologist. Many of those years were spent in the coronary realm, been very involved in structural heart disease, the treatment of from a catheter-based standpoint, and the last 5 or 10 years been quite involved in stem cell therapy in the clinical trial realm. Heart failure is really a big problem, and it is one of the complicating factors after patients have a myocardial infarction, so-called heart attack. Heart failure represents a syndrome of shortness of breath, the lower extremity swelling, trouble lying flat, and this is not the same thing as your heart stopping. This may be the result of a heart attack, but heart failure per se is not a heart attack. I often tell patients that if they were an 8-cylinder engine when they were born, after they've had a heart attack, they might be a 4 or 5-cylinder engine, and they don't quite have the get up and go that they used to have. Cell therapy, or the use of cells as a therapeutic tool, is the concept that if we can take a patient's cells or some line of their cells, some sub-segmented population of their cells, and give them back, that we might be able to improve their symptoms of heart failure, their quality of life, and perhaps even their pump function. So maybe they can go from that 4-cylinder engine back to a 5 or 6-cylinder engine. The CardiAMP study uses a standard cardiac catheterization technique to deliver the cell therapy. This procedure has been around for decades, is very well established, and compared to some of the other things we can do to patients, even in a catheter-based realm, such as structural heart procedures, is very safe. Most of our patients have had a cardiac catheterization procedure before. The patients have access from the groin. A catheter is put up into the heart, so inside the main pumping chamber of the heart called the left ventricle. And this particular catheter allows us to direct to different places within the heart muscle the tip of the catheter, which is literally screwed in. It looks like a little miniature corkscrew into the heart muscle, and we deliver the cells, and then we remove the catheter and move to another position within the heart muscle. And we give 10 injections of cells, with the idea being that the cell therapy hopefully will lead to improvement in the things that we're trying to measure. The CardiAMP study uses the myocardium helix catheter for delivery of cell therapy inside the left ventricle, the main pumping chamber of the heart. There are other delivery systems or other catheter-based systems that allow delivery to this area within the heart or by this technique, but I find the helix catheter to be, in my experience, the easiest to use, the easiest to direct, and after 10 injections, it's very quickly done with a very acceptable safety profile. After the procedure, we usually monitor patients overnight just to make sure there haven't been any complications.